Hello, everyone. This is a mini lecture on inhalants. So this is a really mixed and varied category of drugs. The only thing that substances have in common in this category is that they are ingested or they're taken into the body by inhaling the fumes. There have been some forms of inhalants around for a very long time, but are more recently used for this kind of high or recreational purpose. So nitrous oxide existed in the late 1700s, and then it wasn't really until the early 1900s that you started to see the abuse of these substances take form. A lot of the substances used to inhale are unregulated and difficult to control. There are chemicals in all kinds of products in our daily life that are easily accessible to people and can release. People can experience these kinds of intoxicating effects from inhaling them. And actually, because of the availability, children from low socioeconomic backgrounds tend to be disproportionately the users of these types of drugs. Um, and one of the big dangers that comes from inhaling anything that I'm about to talk about is the risk of hypoxia, which is the inadequate oxygen supply to body tissues. So if you're inhaling a gas that's not oxygen, then you're not inhaling oxygen. It's taking the place of oxygen in that breath. And so the more concentrated and higher percentage of the gas is, then the less oxygen you're taking in and the more risk for organ and tissue damage you may experience. Your book talks about three different types of inhalants. The first are nitrites, which are chemicals that relax the smooth muscles in the body. And these would be the muscles that are in your GI tract. You can also have smooth muscle in your circulatory system. They're really all over the body. There are medical uses for nitroglycerin, which help with heart disease by relaxing the smooth muscles in the veins and arteries. It allows the blood to flow freer for people who have heart disease. The side effects of nitrates would be having a headache, flushing, dizziness, weakness, loss of consciousness if you move around too quickly. So really just a result of dilating these smooth muscles, relaxing the smooth muscles. And why it is that people feel this kind of psychological effects is really unknown. So all we know is that the chemicals relax the smooth muscles, but we also know that people describe feeling warm, feeling giddy, experiencing kind of a rapid or pounding heart rate, and then at higher doses, this kind of lowered inhibition, maybe feeling like their skin is more sensitive and also experiencing a heightened sexual response. Amyl nitrate in particular is used sometimes to facilitate anal sex because it relaxes the smooth muscles of the anus. So one of the common uses of nitrates is in this kind of sexual context. But again, the link between relaxing the smooth muscles and all of these other psychological effects still really unknown. Amyl nitrate, like I mentioned before, does have a medical purpose. It's the only substance used for human use. Everything else in this category is considered for industrial use only. And when taken properly, amyl nitrate has pretty low toxicity, but it is majorly toxic if it's swallowed. It interferes with the blood's ability to transport oxygen, which is one of our most foundational biological functions. And amyl nitrate, when it's swallowed, will interrupt that. And someone can develop both a tolerance and a withdrawal to this substance. And it is a concern for people who have heart disease and are taking amyl nitrate to relax the smooth muscles in the circulatory system, that they may need more and more of the drug to get the same effect. Nitrous oxide is another category of substance. It's an anesthetic, first used by dentists in the 1800s in the form of ether, which was liquid and very, very flammable. It was really impractical. And so they developed a gas form called nitrous oxide, which is used today. It's non-flammable. It's gas mixed with air, which also includes oxygen, and it's a very effective and very potent anesthetic. At a high dose, it can result in a loss of consciousness, muscular relaxation, and pain relief, as well as a euphoric feeling. This is sometimes called laughing gas, and it's used in kind of not major surgery, but when you wouldn't go under general anesthesia, but local anesthesia isn't sufficient. So used a lot in dentistry for that reason. It tends to be less toxic than some of the other inhalants we'll be talking about today, but it can have some pretty serious effects. So basically, what happens in the brain is it increases the action of GABA, which is the no-go neurotransmitter. So it really kind of shuts down brain function across all of the neural networks, which is how you get the resulting loss of consciousness. It may also affect the same receptors as morphine and heroin, the opioid receptors in the brain. And we also think that it acts on MDMA receptors like ketamine. And that's where you get some of the more dissociative effects of someone who is under the influence of nitrous oxide. Anyone who's had nitrous oxide or laughing gas in the context of their dentist visit may be familiar with some of those effects where not really feeling connected to reality, maybe even experiencing some mild hallucinations. There are at least 3 key dangers to using nitrous oxide recreationally, but these dangers also apply in a medical context. You just have a medical professional guarding against them. But the first is just loss of consciousness and death. Nitrous oxide shuts down activity in the brain, and if taken at high enough dose, will just shut the brain off completely and end up killing the person. Also, someone can experience just physical damage to the body from inhaling a cold gas, so experiencing freezing of the mouth and larynx, or the pressure and expansion in the lungs from inhaling a gas out of a canister can be physically damaging to the individual. And then also it appears that there is neurological damage or cell death in the brain as a result of ingesting nitrous oxide or inhaling nitrous oxide. It is possible for someone to experience and develop a tolerance to nitrous oxide, but the way that it's used medically, which is sort of for these one-off surgical procedures, and even the way it's used recreationally, which tends to not be chronic, tends to be more episodic, usually tolerance is not something that develops. Solvents and propellants are the last category in the inhalants chapter of your book. And this is in bold in your textbook, the strongest language that the authors use to talk about avoiding a drug. And it says, if there were ever a drug category to just say no to, this is it. And the authors say that solvents and propellants should never be used by anyone under any circumstances. There is no bones about it. When you read this chapter, it has a very different tone than it does for some of the other chapters. So your lecture question for this week is, why the severe warnings? Why is it that your book is giving these warnings about solvents and propellants in such strong language? Solvents or propellants really are anything put into vapor form and inhaled, and it includes like what we would consider just the wastebasket of industrial chemicals. Just a wide range of chemicals. Anything that is like kind of noxious, kind of stinky, kind of chemical that you would keep in a chemical drawer can be used in this way. It's also called huffing, which is when the gas from the solvent is inhaled. The peak saturation of the compound occurs in a few minutes, and then the high lasts for about an hour. And basically, solvents and propellants, inhaling them or huffing them gives the same effects, are very similar effects to alcohol. It's a depressant, and it also is a little bit of an anesthetic or pain relieving effect. And so you see similar reactions, loss of coordination, drowsiness, and then even at high doses, loss of consciousness or death. Also ringing in the ears, double vision, hallucinations, just a really wide range of effects that can happen when somebody is huffing. What is very scary about this particular type of drug use is the possibility of sudden sniffing death, which is really just can occur, especially if someone is huffing a coolant like Freon or fuel gases like butane or propane. Just experiencing abnormal heart rhythms that cause the person to die instantly. And this is something that just really stood out to me from your book was in the UK, I think it was, there were 1,000 people who had died from inhalant use in that year, and 20% of them almost were first time users. So dying from the very first time that they were using this substance because they are so incredibly toxic. A lot of them can be carcinogenic or cause cancer, but truthfully, people tend to not live long enough to experience the chronic toxicity risks available or associated with this drug. More often, the dangers are behavioral. So, someone getting into an accident or even committing suicide because of the detrimental effects of inhalants on them.